Ankylosing spondylitis affects which parts of the body?
Well, I think of that question in two ways. It can affect parts of the body in terms of the spine and the joints. Because it's a systemic inflammation, it can also affect parts of the body outside of the joint. So it can, for example, cause inflammation in the eyes, can cause inflammation in the lungs or in the heart. We also know that people with ankylosing spondylitis are more likely to get inflammation in their bowel. There can be associated inflammatory bowel disease or inflammation in the skin like psoriasis. And then there's the effect on the joints in the spine. So the hallmark of ankylosing spondylitis is inflammation in the spine, either in the neck or in the lower part of the spine where there's the sacroiliac joints. But it can also affect other parts of the spine, like in between the shoulder blades. This can be another common area. And it can also affect the joints, more so the larger joints like hips and shoulders and knees, but it can affect any of the joint. It can also affect the small joints of the hands and feet. And it can also affect the tendons, where tendons insert into bone, like the Achilles tendon, for example, where it inserts into the heel, or the soles of the feet, like plantar fasciitis, and also chest pain because of it affecting where the ribs articulate with the sternum.
What ages does ankylosing spondylitis affect people?
So often it'll start in young people. We are very suspicious of ankylosing spondylitis if back pain develops before the age of 40. So it's very common for it to start in people's 20s, for example. So it can occur at any age. It can start in children, but commonly sort of in the 20s and 30s, and definitely before 40. It's rare for it to start after the age of 40.
Does ankylosing spondylitis affect men more than women?
Yeah, definitely. It's a disease that, especially the classical AS type that can cause fusion in the spine, tend to occur more in men.
What are the symptoms of ankylosing spondylitis?
So the symptoms are the hallmark of inflammation. So it is stiffness and pain, and especially stiffness and pain after immobility. And that's what differentiates it from other kinds of back pain. So if people have back pain when they have to sit for a long period of time, like sitting through a car ride or a plane ride, or sitting through school or at work, or pain that wakes them up at night because that's when we're immobile for the longest time, or pain that is more severe in the morning when they wake up, along with some stiffness in the morning. But stiffness in the morning has to be longer. Like just being a little stiff when you wake up and as soon as you move it goes away is not really suspicious. But if people have stiffness that lasts for more than half an hour in the morning, then ankylosing spondylitis should be something that we think about.
What tests do you use to help in the diagnosis of ankylosing spondylitis?
Ankylosing spondylitis is not a diagnosis that we can make based on a blood test. So there's no definite blood test that will say, yes, you have it, or no, you don't have it. Some blood tests are helpful, and the most helpful blood test is probably the marker of inflammation, because AS is due to inflammation in the spine, and usually the marker of inflammation will be increased, although there can be exceptions to this. There can be patients that have active inflammation and a normal marker of inflammation, but frequently it is increased, and it is a useful test for us to determine, is this back pain due to an inflammatory cause or a non-inflammatory cause. The other test that's really important is imaging. So we can determine that there is imaging in the spine or in the sacroiliac joints particularly through an MRI. That's the most helpful test to show inflammation.
Are people with active to moderate ankylosing spondylitis at a higher risk for developing comorbidities or chronic diseases?
Yes, definitely. So there's, as we talked about, some extra-articular features. So the inflammation of AS can cause them to have other diseases. But then there's also the fact that the inflammation is systemic, and what we mean by that is that there's inflammation in the whole body, it can also cause other chronic conditions that we know are linked to inflammation. So things like cardiovascular disease are increased, so increased risk of heart attacks, and osteoporosis, which is thinning of the bones, which is a little bit paradoxical because AS causes extra bone laid on the spine, but that bone is brittle, and so there's an increased risk of fracture from osteoporosis. So those are some of the examples of the other chronic conditions that are increased in AS.